this morning I'm very, very excited to address the topic of the future of the Australian aesthetic nurse injector, shaping regulatory reform through industry leadership. I have some amazing thought leaders that I'm delighted to welcome to this meeting and to this presentation, this roundtable discussion. And they are renowned and they are very, very special. And it is my pleasure to quickly introduce each one of them. So I would like first to introduce Elissa O'Keefe. And Elissa is an endorsed nurse practitioner, adjunct associate professor at the University of Canberra. She's published widely in the Cosmetic and Advanced Nursing Practices. I then would like to introduce Debra Harris. Welcome, Elissa. Debra. Debra is a cosmetic nurse trainer and assessor for Aspire Training Clinic. She brings more than 10 years of experience in cosmetic and aesthetic industry, and she's a trainer and assessor for the Australasian Academy of Cosmetic Dermal Sciences and very passionate in the area of education. Madison Berry, welcome. She's from Ascension a cosmetic medical clinic. This is a very renowned medical clinic in Brisbane with over 25 staff, and she's a passionate practitioner, nurse, registered nurse with over 3 years of experience in dermatology, aesthetics, and advanced skin procedures. And she will share with us about her perspective of what consumers want today. And then we have Dr. Bilt, who's a medical advisor, renowned educator in cosmetic medicine. Dr. Bilt has a bachelor's of biochemistry from the University of Melbourne and a bachelor of medicine and bachelor of surgery. I've known her for quite a few years, and I know she oversees a lot of different groups with over 600 nurses and doctors, and also she's the medical director to oversee the regulatory compliance. So she's a very valuable insight to see what she has to give to this group. And then we have Rebecca Kimberley. Now, Rebecca has a medical background. Her specialty is in the cancer division of the medical oncology unit of Princess Alexandra Hospital. However, she's very, very passionate. She's come into the cosmetic medical field, and she is keen to assist in the regulatory side and in looking at a nurse-led governance framework that could be useful to us in presenting to government what our perspectives and what our needs are. So welcome to the panel. And I will start with Dr. Bilch. I know she's a very busy lady and she may not be able to stay for all of the meeting. So her question is, Dr. Bilt, should all cosmetic injectables training include areas of like anatomy, physiology, complication management, and patient assessment as core requirements?
Thank you, Tina. That was a long spiel you had to go on. So I definitely think that because I do training myself as well for newer injectors, and all the parts that you've mentioned are essential. I actually think that the most important part for any aesthetics practitioner is the consultation itself. So for sure, by understanding the anatomy, physiology, you're able to then educate your patient more in depth. And sometimes what they want might not be achievable, and really to understand what you can and can't do, and how to tell them that. I think it's a work of art. And sometimes you have to say no, but you have to have a good reason to back yourself up as well. Patients may want what they want, but you as the specialist in the field, you should be able to then tell them why they should or shouldn't have what they're requesting for, and also what's realistic and what's not. I think another important thing is when educating newer injectors, for them to understand not just how to do it, but also how to fix things when things go wrong. And if you don't understand how things work or the anatomy, then it's very difficult to then try to understand how to fix a complication.
Absolutely. Madison, I want you to jump in here. What are your thoughts on that from a practitioner point of view?
Yeah, I couldn't agree more with what Dr. Bilt has said. I do believe having that sound structure of anatomy, physiology is really key because we're dealing with complex facial anatomy. But there is so many other layers as well with cosmetic nursing, and that's the whole journey throughout the consultation, like you said, Dr. Bilt. And we do get a lot of clients and the consumer coming in that have done their own research. They've heard about Redurin or other products, and they're coming directly to you asking for that. But it is really up to you to give them your knowledge and expertise as to what actually will be better for them.
It's about re-establishing your authority as the that you're driving the integrity of the profession. And I love what Dr. Bilt said also is that it's appropriate to say this isn't correct for you. And I think that's very, very, very important because it reinforces our staying within the what is safe for the consumer as well. Safety is very, very critical today. And I think when you identify that something is not appropriate, to alert them that this is not recommended, we have a duty of care, and we've just got to adhere to. There's so much dysmorphia at the moment, and the issue is if you don't draw the line, you can continue to feed a condition that's not really healthy. Any other comments, Elissa, would you want to say anything there?
Sure. How could anybody not agree with Dr. Bilt? That's a complete no-brainer. I'm delighted to have Madison here because she represents what the modern face of cosmetic nursing looks like, which is not just injecting. And whilst I totally agree with the need for anatomy and physiology and the mental health aspect, cosmetic nursing scope of practice is way bigger than just being on the end of a needle. So I would just add to that conversation that a really solid educational underpinning across the board in dermal sciences and cosmetic injecting is essential, which is probably a perfect handball to Deb. So
I'm just going to say, Deb, what are your thoughts?
I agree with all of that. I do think that a clinical recognized qualification should be the basics before you even start going to inject, because there is a lot going on under the skin. I know a lot of them don't want to do skin and dermal, but it's the whole package. The industry's changing, treatments are changing. It has to be skin and then injectables.
Mhm. Rebecca, any thoughts? Any thoughts from you? Rebecca, can you hear us?
I can. Sorry, I couldn't find my unmute button. Yeah, I completely agree. Absolutely. I think that there is a much wider and much bigger picture. It's a clinical environment, and therefore the patient, the client should be, fully assessed, and we should expect that knowledge to be there, that knowledge base to be there. It's knowing the whys and wherefores. And the theory behind what we're doing, which is really important to be able to troubleshoot and to give the patients, the clients, the best service that is right for them, and tailoring that service, I think, is really individual.
Okay, I'm going to jump to you, Elissa, with your question, which is a nice, heavy, juicy one. And that is in relation to the landmark case of Zemas versus the Nursing and Midwifery Board of Australia. What do you think are the opportunities for the cosmetic injecting nurses? But also just give us a quick overview of what the court case was about as well. Thank you.
So first of all, hats off to Nikki Zemas for having the guts to go after the nursing board. So thank you, Nikki. The upshot of it really was that she fought for a nurse practitioner scope of practice in cosmetic nursing and did a really great job of highlighting the complexity of what we do, particularly in that advanced practice landscape. And also she's a mental health nurse by background, and she really was able to tease out the complexity of mental health. Perhaps we could get the link to that case in the notes when we finish, Tina. So if you're a nurse and you haven't actually read that case, it's quite an easy read. So please have a look at it. So with regard to nurse practitioners, to be clear, we've had nurse practitioners in cosmetic nursing for quite some time, and some some great examples of who's on the landscape is nurse practitioners like Anita East, who has done a lot of work around educating about body dysmorphic disorder and empowering women. She's a great example of a professional nurse in action, as is somebody like Robin Curran, who is an educator. And one of the things that has got missed about the journey to nurse practitioners is how essential it is to not only have a strong clinical practice and focus in that advanced delivery of care, but also the education and the research that goes with that. So what we're starting to see, Nikki's case is almost like our pilot light. So we've got our pilot light, that is Nikki. So what had happened historically is nurses have been discouraged in becoming a cosmetic nurse practitioner. So what she's done is she's showcased what's possible. At the other end of it, we have the guidance from APRA, who has said once you become a registered nurse, do 1 year postgraduate experience and then move into cosmetic nurse. So what we've kind of got now is these two beautiful bookends. What we need to do now, though, is fill in the middle, and we've got all the tools for filling in the middle. So the tools that we've got are the documentation of advanced practice. There is any number of tools from multiple universities. The College of Nurse Practitioner as well has tools for nurses to document their advanced practice. We've got a landscape that we all agree is changing rapidly. There's exosomes on the scene. There's peptides on the scene. We've had all sorts of new products come and go that are just ripe for nursing research. What we also have is two AQF 8 frameworks for cosmetic nurses. We have the Australian College of Nursing Graduate Certificate in Cosmetic Nursing, and of course we have the AQF 8 AACDS Cosmetic Nursing Graduate Diploma. So we need to start putting in all those pieces. One of the pieces that we're missing is the research around what we actually do as a group. The limitation that cosmetic nurses have in filling in the middle is that we're busy running around our own practices, or busy having a life, raising children, studying, that we're quite time poor to be able to fill in those gaps. So if I was to ask for anything of the regulators, the decision makers, some investment into research would be amazing.
Well, let me say something. You touched on something very important, and that is the practitioner is very micro, but the industry needs to be macro. So there is a position where we step back and look at the landscape, and we look at where is everything heading, what's missing for us to gain recognition and to move forward with greater respect from the regulators. And this is the area where an industry body can be very useful, because that's our role. I mean, I've been recognized for the Order of Australia, and my work has predominantly been macro. And because the macro work is behind the scenes, a lot of people don't get to see it. But to me, it is critical for the survival of an industry, and also for profiling and encouraging the industry to move in a direction where they can fit better in the landscape of collaboration between doctors, nurses, aestheticians, in order for us to work together. And I must admit, I'm passionate about formal education and qualifications, because they may not be perfect, but they are line upon line, precept upon precept. So you establish a solid framework on which then you definitely need the ongoing professional development. So thank you, Elissa. That was very well presented. Now, Dr. Bilt, did you want to comment on what she mentioned at all?
Sorry. I mean, I think Elissa's pretty much covered it all, and I think it's just having a good read of it yourself to really get the full picture, because it's definitely interesting, and I think it's great that we're fighting back as well, and not just letting. I don't want to say anything bad here, but I guess we also need to stand up for what we believe in. I think that's the most important part of this.
Okay. Rebecca, any comments?
Just in support really of what Elissa said. I think that education, and agreeing with yourself, education is really important, and it's bringing the clinical practice and advanced clinical practice into an area that perhaps has been overshadowed in the nursing space before, and bringing that through and being able to succession plan for the future.
Debra?
Well, as you can see, I'm currently sat in my car at the train station because I'm off up because it's the prac this week for the graduate nurses from the diploma. So I'm very passionate about the formal education. I've also done some of the other side of training. So I don't think any training is bad. I think the more you have, the better. But I do agree with Elissa that it should be formal first.
And Madison?
I agree, formal education is really critical, but there is a massive benefit as well as having in-clinic training too. Mentorship for me has been massive. I've probably picked more up in that practical sense than maybe what I did in a learning space. And that could be, your way of learning and comprehending things. But once you're actually in there in your career and you are being repetitive and you have that mentorship, I think it all just really gels together well.
Well, the formal gives you the foundation of the direction of how to think and how to measure situations in terms of evidence-based knowledge, that you use that on which then to identify how the practical is going to fit in and how you interpret the practical. So I want to move on to Debra now with your question. As an educator, what concerns you the most about the current state of cosmetic injecting education in Australia?
So I think pretty much everybody's already said everything. I do believe I did my postgrad 10 years ago, and the industry has changed a lot since then. I do think that it should be formal. So every other speciality has a postgrad. You have to have a postgrad in theatre nursing, pediatrics, midwifery. Why don't you have one for cosmetic nursing? And then will be recognised as a speciality. I think that's been a hindrance for us. I think that once you've got the foundations, now not everybody's going to do the foundational courses, which is fine, the formal courses. Some people don't want to invest a year of their life studying and then having all that, but I think they should. And I think if it's pushed more in a way that people can see the benefits of it, it's better. And then no disrespect to the in-house trainings and the mentors, it's all important. I also train for some of the companies, and it's all important using different products, different skill sets. Like Madison says, you pick something up from everybody. So it is important. The weekend courses, I've trained on those. They're also really, really interesting. Dr. Bill has been my prescriber before now. So I've worked with her too. So there's some really, really good people in the industry. There's some really good training in the industry. It just needs to be more driven, and I think more people aware of it. And the benefits of doing skin as well as inject, because a lot like the postgrad cert, that's just inject. There's no prac, it's just inject. So people can do that if they're not interested in skin. But who wouldn't be interested in skin in this day and age? It all goes in together.
Well, one of the things we've seen since COVID, and that is I've worked with Professor Lawrence Walsh, and we did a risk management document for what are the manifestations on skin post-COVID? And he wouldn't respond. He said to me, I'm going to wait for more papers. And then he came back to me, he said, I've got over 100 papers now, and there are definitely persistent skin manifestations post-COVID that are linked to the circulatory system, the inflammatory condition in skins. And what we're hearing is that in skin therapies is that there is much higher reactions and more inflammation in the skin. So I think if you're injecting, understanding the undercurrent of that person's capacity to respond to the treatment and the potential for the inflammation to trigger some kind of adverse reaction, I think is useful. And really we are not working on the epidermis, we're working on the dermis. So understanding the health parameters and the state of that person's clinical health is very, very useful. So, and also I think nurses now are looking at moving into some of the skin therapy divisions as well. And there's a lot of crossover. Wouldn't you agree, Dr. Bilt? There is, everybody's now mixing a little bit of everything.
I completely agree with Deb, Tina. I think in this modern day and age, everyone is about skin health. And if you're an injector, I think you just see that in terms of what kind of patients you get come in, what kind of treatments they're requesting for. It's actually more skin focused rather than inject. As we all know, the anti-wrinkle's never going to go anywhere. But aside from that, I do think that devices are very much up and coming, your energy-based devices. Knowing about them as well as inject is so important. And that, is a world of its own. There's different challenges, different complications, different management for them, and different assessment. And going to conferences lately, there's been a lot of new skin analysis machines as well and devices. I think that's really cool. And getting to actually target someone's concern really superficially all the way down to your bone structures with your inject as well is so important. It's just that holistic view of treatment.
Madison, I want to ask you to comment, but I want to ask you, are you finding that the consumer now is looking for a more natural, healthy glow as the finishing outcome rather than just the enhancement? What shifts have you seen in recent years?
Yes, absolutely. I would say, most of the time, 9 times out of 10, one of the first things that the client actually says straight off the bat is, I don't want it to look like I've had work done. And that's where they're becoming more educated themselves, whether that's through watching videos or Instagram and things like that, of the sorts of treatments that they can do. And most of them are starting with skin treatments and then dipping their toes into things like bioremodelers and biostimulators. And from there, it also opens up a part for me to educate them on that and maintaining their skin health alongside with energy-based devices. Of course, other injectables like dermal fillers have their place, whether we're, replacing some bone structure with, if we've got bone reabsorbency, it all fits together really well. But there is definitely much more of a push from the consumer themselves on a skin-first approach, which I think is fantastic.
Yes. Well, unless your skin is glowing, I mean, the enhancement can help the shape of the face to look more youthful. But ultimately, the vibrant, I mean, this is why we had the trend for the glass facial, where the skin looked just very, very glowing. And I think glowing skin is always youthful skin. I remember I saw a lecture years ago where a plastic surgeon was showing how when looking at a baby, the thing that you notice is there's transparent, you can see the blood coming through the skin. There's this youthfulness and healthy presence of the skin. And as we age, we start to get pigmentation. We start to have less transparency where we can't see the dermis so much. And this is what he said, if you look at that as your model, is trying to create the skin to look more youthful, better color, but also clearer. A clear skin is a young skin. Yeah, so that's the focus. Now, I want to move to you, Madison, to your question. Why is rigorous training so important in cosmetic nursing compared to other areas of aesthetic and skin therapies? So, the disciplines that you bring to cosmetic medicine, what are the areas that you feel require ongoing education to perfect it? Is it safety consideration, or is it just technique, or is it a combination of both? What are your thoughts?
Yeah, so I think we've touched on it a little bit, but I think it's a combination of both. Obviously, you want that foundation knowledge of anatomy because we're working with complex facial anatomy every day. But staying up to date with best practices, everyone has their own way of doing certain things. For me, being able to actually have that observation of other clinicians and doctors in the practice to see why they do things a certain way that they do and the evidence behind that has really shaped the way that I practice as a cosmetic nurse. Sorry, I've drawn a blank.
Okay, Elissa, what's your thoughts on what she's
Um,
sharing?
I agree with Madison. There's nothing like hands-on training. Hands-on training, though, in a clinical setting combined with rigorous education is a complete no-brainer. You were just talking about, Tina, what consumers are looking for from a clinical perspective and, what their aims and their outcomes are. But what I think we're going to see more and more is our consumers are so savvy. They're going to be looking for those postgraduate qualifications sitting up next to your APRA registration. And they are really understanding what the difference is between the different types of education as well. So, as that landscape becomes more competitive, and it will, and the demand is not slowing down, I think one of the things that having a qualification is going to do for cosmetic nurses is set them apart from their competitors and raise the value, and they'll be more what's the word, enticing for consumers because not only have they shown an investment in education, they've shown a sense of a career pathway, but also we've talked multiple times already today about safety. If I'm a consumer in this landscape, I want to be in the absolute safest hands.
Absolutely, yeah. Well, since COVID, safety is also now in par with efficacy. Whereas before it was all about what results, how can you make me look? Now the consumer is more educated, but they also, I think that we experience is the COVID really affected people's perception of their mortality, and they are well, obviously we were, hygiene became such a big thing about preventing transmission, but it's moved to the issue of what are you injecting in me and is it safe? And so there's a lot more awareness that what am I putting in my body and is it evidence-based and that sort of thing.
And certainly we've seen that recent case of the imported botulinum toxin where people were admitted to intensive care with botulism. So we've got these cases of really scary outcomes.
Mm-hmm. That's good. Rebecca, do you want to say something here?
Sorry. Yeah, really, it's just agreeing. I think bringing, optimizing the nurses that we have. I've met some so highly skilled aesthetic nurses, and they need to be celebrated. They are nurses ultimately. They're not skin therapists, and they know what they're doing. And we should encourage that, and we should lay pathways for them to optimize their career as nurses in their speciality.
Debra, what are your thoughts about the crossover between the skin units and the injectable training? Are you finding in the last, because you've been in this industry now for about 10 years, you're finding that the trends of consumer outcomes have shifted? And in what way is the education allowing them to become strong in those areas?
There is a really, really big crossover. And I think until you start doing the skin things and you do your prac, like the ones I've got at the minute, now it's all making sense to them. And they're all saying, I loved doing my dermal. I loved that. I loved doing the treatments. And now they're excited for their injecting. In my workplace, you're always, if I don't do the dermal treatment, I have a dermal therapist. I refer to them. So we're all good at what we do, and it's just bringing the dermal side of it more in focus. And I don't want the AACDS is the only level 8 qualification, and it covers dermal, it covers laser, you get your laser license and the inject and the complications. It's a really, really good course. And I think now with that court case that we now can apply for nurse practitioner, it's the one that you're going to want to have to put towards going for your nurse practitioner as well.
Well, that's excellent. That's very, very good to know. Okay, I'm going to go now to Rebecca. And from your experience in governance, what value would you see a nurse-led advisory and governance framework can bring to nurses? And how do you envisage that the framework can be presented to government for regulatory consideration?
Yeah, so thank you. I'm very new to the cosmetic aesthetic nursing industry. I've been a nurse for 100 years, but not in this industry, and a nurse practitioner for about 7 or 8 years now. I moved into the aesthetics industry a little bit by accident, and a little bit kind of with the new regulations that were coming into force in Queensland last year about needing a nurse practitioner prescriber on site was my kind of segue in, and that's how I found myself where I am. But what I found was, coming from a very governance environment within the public health system and quite cancer being the speciality, I really found that there was very little governance. There really was very little clinical kind of pathways and guidelines. So to me, I would look at something that was a nurse-led framework throughout, either statewide or nationally, that standardises the clinical oversight, which I have found to be quite inconsistent. I found it to be very industry driven as opposed to clinically, and certainly not nurse-led. So a few kind of topics that I looked at looking at governance was how we might make changes. And presenting that to the government would be looking at professional, and we've covered a lot of it today, but looking at professional legitimacy. So as nurses, I think that the regulation at the moment is quite fragmented, and the environments that we work in are all a little bit blurred. So really having some delineation around those clinical roles, standardising and credentialing of nurses, which we've touched on today. So looking at the formal training pre, post and advanced level, and really having some credentialing around that is national or at least statewide. So looking at the novice injector, which is me, through to the advanced, through to the expert, and laying pathways for that career development. I'm getting old, the nurse practitioners are getting older, we need new ones in the future. So how do we develop and succession plan our current aesthetic nurses who are going to be the experts in the future, and to move with the times and be the future prescribers? So looking at formalising that. Risk management, which is always a government kind of buzz, and I've certainly spent a lot of time looking at prescribing the S4s, looking at incident management, regular auditing, and being audit ready, in line with the APRA and the NMBA guidelines. Consumer protection and transparency, you're right, our consumers are getting really savvy with the products they want. There's so much exposure out there, whether it's TikTok, whether it's Facebook, whether it's, my friend had this done, how about this done, so it's really having the transparency with the consumer, really individualising and tailoring that care with our clinical experts. And what I'd like to see is that we bridge the gap between medicine and beauty, and bringing that industry together, reducing the reliance on reactive regulation. the changes that happened in Queensland last year, I believe, were reactive. There was very little nurse interaction, if any, looking at feedback, looking at, consultation with the real key stakeholders. It seemed to be very reactive, and it left a lot of people confused and really not knowing which way to go forward. And I think all of these things then will enable a proactive but professionally led regulation within the beauty industry. And with the cosmetic industry, and having it as a standalone speciality where you are an advanced practice nurse and you do know your stuff, and we are giving the best care to our consumers in exactly the same way that I am doing the same with my chemo patients,
Exactly.
today. Yeah. And my nursing here today, it's not more of nursing than it is when I'm in my clinical role in the clinic, in the aesthetic clinic. It's the same but different,
Yeah.
And yeah, absolutely, it's a speciality that should be standalone. And I would really like to see, and I had a conversation with Elissa out of session about, really seeing that the nurse practitioners are linked in and supported. This is new to me. When I came into the role, I really had no support. Am I doing this right? What are my expectations? What am I doing? And really not having that clinical support around me to be able to lean on my peers as I can in other roles, to be able to know whether I'm doing things right from a clinical level. From an industrial level, I can move forward with the guidelines from an industrial perspective, but from a nursing perspective, I need my nursing colleagues to be able to know which way is forward and how we make progress.
What you're really describing is the macro perspective. And usually what happens in an industry, you have innovation, you've got a lot of technological development. So the pendulum swings towards product training and product focus education, and it becomes and that's useful. But the issue is we need balance, we need objectivity, and we need to look at it's more ethical to put the pillars of objective education to what is being framed, because there is no doubt. I mean, the responsibility of a cosmetic company is to familiarize you with their product and the capacity and what their product can deliver. Their role isn't to teach you how to measure safety issues and how is this going to work with the consumer, in assessing their needs. So there is a position and a role where the industry can put its heads together and come up with clear guidelines of what we consider to be the right educational development strategies that will be the spectrum can be objective, but also evidence-based and ethical. I think ethics is huge. We've lost sight of ethics a lot of the times. Ethics as well as foundational knowledge on which we can benchmark the commercial side. So we've been
perfect.
So heavy on the commercial side. We need now the academic side of that is evidence-based, objective, credible, and we all as practitioners speak the same language here. But then how are you going to measure when someone says something to you? Like, for example, with this new regulation, there was a lot of companies that were selling product and they weren't TGA approved. And so it opened up the door for nurses to actually buy offshore products that weren't even known if they were safe. So that was the dangers. Again, it's ethics, but it's guidelines that allow you to understand. I'm not saying I work with the TGA and I don't always agree with them. I think sometimes they over-regulate, but at the same time, their key responsibility is to measure safety of that product. If you buy a product from another country and you've just bought it through that channel, you've got no evidence that it's safe. So there is the risk factor there. So ethics plays a key role in us questioning what we do, does it have credibility? And I think this is where having a framework like what you're suggesting, Rebecca, I think would be very, very valuable. And I would open it up to everybody in terms of how do you see this happening? Would you like to get involved with it? Because I would like to create, at least APAN can open up that platform for nurse engagement. So, Elissa, what are your thoughts?
Look, I totally agree with you and with Rebecca. And Rebecca, I'd just like to circle back to what happened in Queensland. I agree it was reactive, but one of the things that really has made clear, and I think you and I have had a very similar experience in acting as clinical directors in Queensland as nurse practitioners, is the ability to audit practice was absolutely wonderful, and to spot the gaps in not only clinical governance but professional governance, safety, who the referral networks are, putting things in place to audit the Schedule 4 medicines, the whole support for CPD that nurse practitioners can do in that space as well. So one of the things that I've really been happy about with the changes in Queensland, and I wouldn't be surprised if those changes go across the board. But one of the things I've loved seeing about that is the nurse practitioners stepping up to support their peers and putting all of those governance structures in place. So whilst it was really disruptive and a lot of nurses did go out of business, I think from a credibility and safety and professional perspective, it's actually been a move in the right direction. Really interested to see what the rest of the panel think about that as well.
We've got a doorway straight to the governance of Queensland in this space. So if we can come up with recommendations, I think that will help to shape the future, and they can see that we are taking our safety and we're putting forward well thought recommendations that are going to be improved. They're not violating current regulations, but they're also protecting the industry moving forward. So it's not. I mean, what do you guys think about the fact that that they now want a nurse to have over a year of practice before she can even inject?
So good. I'd probably say more. Because you have a lot of them now that they qualify, they graduate, and then they do their postgrad alongside their hospital graduation program, so that then when they've done that 12 months, they're straight in and injecting. Some of them can do that, some of them are not ready. And I think it shows when they come to prac and they suddenly realize, because I say to them, an injection's an injection. You're nurses, you know how to do an injection, but it's when you're doing it on a face, suddenly they're like, oh, this is real. This is scary. And you're like, yes, it is. So maybe more than 12 months.
From my observation, I found a lot of young nurses were, it was very alarming to me because they were having they were holding a position of it being a cosmetic thing, and they weren't looking at the medical and risk factor, and they didn't have a problem buying things off the internet. And also they didn't have a problem in sharing medication between one patient and another. These are things that the regulators now have stopped. But there was a tendency to be a little bit flippant because they were nurses and they only operated because they did a 3-day course somewhere. So because of that, they often miss the more boring issues, but that are important, and that is the safety considerations. And when we used to challenge them on it, they would say, well, I don't care. There's nothing to stop me. And that was very alarming. And I have to say that a lot of this issue has come about because when we confronted APRA and the TGA about why did they step into immediate regulatory outcomes without industry consultation, they said that they were getting a lot of complaints, and they then put up a complaints section on their website, and within 2 or 3 months, I had over 600 complaints. So normally for advertising, it goes under the Australian Consumer and Competition Department, and they didn't even get involved. They went straight to stopping what can be said from a TGA and an APRA perspective. And the argument was it was because we felt we had the right to move quickly because we considered 600 as a matter of urgency and high risk. So we had to step in without consulting anyone. Elissa, you want to say something?
I do. Can I be very clear amongst this group and for the audience that it's not nurses that are the majority of the complaints. This is an across the industry issue. It's not just nurses. And actually across the complaints, although nurses do most of the treatments, they're not overrepresented in those patient complaints. So it's an issue shared by multiple health practitioners.
Okay, that's a good point. Yeah. Okay. Madison, did you want to make a comment here?
Yeah, I think I'd like to go back to the suggestion in the framework with the education. I think having staged education for the newer injector, but also, the injector that's been in the industry for a few years now, but wants to develop and become more advanced. And then for the more advanced injectors. So that gives you a nice pathway for you to go on and have something to build. Yeah.
Mm-hmm. Yes, Debra.
So the AACDS, we are just building a injectable skill set for nurses that want a formal qualification, that have got more than 2 years experience injecting. And it's a 6-month course, and you get a nationally recognized certificate at the end of it. And you can also use that towards your postgrad dip if you want to go on and study further.
Mm-hmm.
So there is that in there now, helping to bridge the gap.
That's wonderful.
Okay. Now, from everything that's been said, Rebecca, what would you like to see happen if we're going to work in order to work with the industry? I'd really like to pursue something with this because Rebecca's expertise is in the putting together a structural proposal for regulators that is also fed and given the nurses the opportunity to contribute to that. Would any one of you ladies like to work with us on this?
I would.
Yeah, okay. What about are you, Alicia? Are you interested in supporting something like this?
I am, except I have an except. It needs to be properly funded and supported at that macro level that you talk about. I can't tell you how many hours I've done, not for free. It's not the for free that bothers me, but it's all of the energy that's been put into things like this without that high level support to start with, to enable us to do it. So to start something at ground roots and try and push it up, I think that's just a ridiculous idea. But to have it driven by people with real clout and real decision-making power, I would be on board. Yes.
Okay, now let me say something. With my award that I've received, I have had federal opposition, federal government representatives say to me, "Do you want any funding? How can we help?" So I've got an open door right now to put forward a proposal and look at putting together a proposal to the government about establishing an industry-driven regulatory framework that can help partner with the government to make sure that the outcomes are well balanced and they're robust and they correctly interpret what the industry needs and how the regulations are going to be interpreted. I can put a proposal to them and look for some funding, because I agree there's a lot of work that goes in this. And having worked in the regulatory space, I have almost gone bankrupt because if there's no funding, it makes it very difficult and painful for those working behind the scenes. And also to do things correctly, if you've got a little bit of funding support, it helps. But we got to pursue it from the angle that we are looking at consumer safety and also protecting the reputation of the profession to be based on regulatory compliance, but also good educational frameworks that will be the safeguard for the industry. But we need to outline what is the objective of the regulatory framework and what do you want to achieve through it, and in what ways it's going to bring a better outcome for the industry and a better outcome for the consumer. So I'm interested to put together a proposal and look at some funding for it. And so if we get some funding, would you be interested in working with Rebecca, Elissa on this?
I was just thinking about that. Well, the answer is yes, and collaborating with organisations like the Australian College of Nurse Practitioners, who already manage a lot of funding already. But I would do it again with a caveat that this would be driven by nurses and it would be owned by nurses. Let's call out the elephant in the room. This is a commercial space that we work in, and often the other providers that aren't nurses are quick to reduce their scope of practice and their ability to practice autonomously. One of the other fabulous things about having more nurse practitioners come into this landscape is the ability for nurses to educate, lead, and support nurses. So, provided it was a nursing governance framework, not an industry framework, I would absolutely be interested, yes.
Mm-hmm. Okay, well, what I would need from you is some recommendations of what we should be, requesting. So, what kind of funding would we need? What is the scope of what we're trying to achieve? So, I think if you're interested in working with Rebecca on this and give me some kind of proposal that you think would describe what I want. Also, the time frame that you think it will require for the writing of it, and also what you envisage it will achieve. And if I was paying both of you, what funding would you require for undertaking this? Because it would be a pioneering thing, I think, in terms of benefiting the industry. So I'm happy and in my position where I'm sit now, and that I've got open doors to reach out to the government for funded programs, but they have to be well structured and with clear objectives and also a figure of what we're looking for. And I think if we position it like that, we can secure some funding for help supporting this, because it is a big project, and people deserve to get paid. Sure. So if I can, I've introduced you to already having discussions. You can go through it with that now. With Debra, what are your thoughts about? You could probably share some information of the educational standards that we need to, or courses that we can give recognition, perhaps, in terms of foundational education for nurses. I think some of the projects you've got are very, very good.
I am biased. I've got to say, I am biased.
Well, I'm also working with Demi International.
They are wonderful people.
I want to get some funding for the laser and IPL side of professional development and training. 'Cause so many businesses have got underqualified people, and they are struggling a little bit. So, to get step up your knowledge, it's very costly. And so, if I can secure, I've been successful with 2 government funded projects with 97% completion rates. I've got a very good, history of successful undertaking this as an industry consortium, because my role is to orchestrate, and I don't get paid from the government for this either. I get paid from the college. The college can give me a small honorarium towards my fees, but it's been the story of my life. Everything I do has got to be free. But anyway, those days have to change. But yeah, so okay, that sounds wonderful. Madison, what are your thoughts with all of this? Would you be interested in contributing to, if we're working on a nurse framework? Would your organization want to have a say in all of this?
Yeah, I think definitely I could provide on the ground feedback in terms of, what's actually going on day to day, things changing with the consumer and things like that. So yeah, I could provide that feedback.
That's good. Okay, well, thank you, ladies. I think it's been very productive today, and I'm very excited about the future. And if we can,
It is exciting.
if we can pursue something more structured and useful to the industry, I think wisdom of the combined wisdom of collective brainstorming is always useful. But look at you all, you're so talented and knowledgeable, and it's wonderful to know that you can contribute to the future of your profession through your academic and practical understanding of what is lacking. And really, I think the industry needs to be responsible for protecting the future of their practitioners, but also creating exciting pathways that are endorsed by government. That's also useful, and also to create an environment and a framework that the industry can look forward to and aspire to. But really, this is where collective energy can work very nicely, when we do it with the right intention, with integrity and with humility, and for the benefit of those we are serving. And we have that pure motive where it's not commercially biased in one direction or another. It then gives it credibility, and I can assure you it will create industry engagement. I think it'll be very good. But for today, thank you all. Thank you, all of you, for your wonderful contribution. Deb, I'm so appreciated that you are able to come, even though you're running off.
The sun's come up now, look.
Yeah, I know. Okay. Well, thank you so much, and goodbye for now. And let's keep the conversation going. I think it's exciting.
Beautiful. Thank
Thank
you.
you.
Thanks.
Thank
See
you.
ya.
Bye.
Bye.